Hi, I'm Lisa, and this is my handler Megan, and this is Reno, and this is my horse health check video. I'm basically going to explain how to take vital signs, make sure the horse is healthy. So to start, you just want to look at the overall appearance of the horse. Reno is very bright-eyed and alert, and he isn't showing any symptoms of pain. Some symptoms of pain would be lifting his lip, or if he's colicky, even looking at his side. And overall, he's nice and relaxed and bright-eyed, and he's looking good, and his coat is nice and shiny and healthy. And so he looks like a pretty healthy horse. Okay. The first vital sign I'm going to demonstrate is mucous membranes and capillary refill together. So what you do, you want to pet the horse, let them know you're here, and very gently lift their lips so you can see their gums. And you can see his gums he's very drooly, nice and pink and moist. And so that's a really good sign. That means he's hydrated, and pink is a good sign. If they are pale, that could mean they are going into shock, or they're anemic, or they're even sick or dehydrated, and it's good to see that much moisture because you don't want them to be dehydrated, and that would have very dry gums. Some bad gum color would be brick red, which could indicate an infection. Blue could indicate lack of oxygen, and just white is pale, and that can be, like I said, anemic or dehydration or something. So a capillary refill, again, you're going to lift their lip and just take your thumb. You don't want to press with your nail, and just press on their gums and wait for it to turn back to the normal color. So you see it turns back to the normal color in about a second. That's a good sign. Basically, a capillary refill is how bad the capillaries refill with blood, how fast the capillaries refill with blood. If it takes 1 to 2 seconds, that's normal. Any longer could indicate dehydration. So that's a good sign. He's healthy, he's hydrated. Another place you can check their mucous membranes is their eye, the conjunctiva. If you very gently go up to them and pet them and lift down their eyelid, you can see it's nice and pink and it's not pale, so that's another place you can take it. The next vital sign I'm going to demonstrate is the pulse. You can take it in 3 places. There is maxillary, which is right under the jaw. There is radial, which is right here at their knee, and then there is digital, which is right down here. So I'm going to show how to do it under their jaw, the maxillary. So I have my handler Megan, who is going to time me, and when I find it, I will ask her to start. She's going to time for 15 seconds, and then I will multiply that by 4 and give the result. A normal pulse in a horse is 32 to 44 beats per minute. It does depend on the horse. If it is a little bit lower, they may just be really relaxed, but if it's quicker, maybe they were just working out, or they're scared, or it can be an indication of pain. And that's why knowing their pulse is so important. Okay, now I'm going to find his pulse. Start. So 9 times 4 is 36. So that is a perfectly normal pulse. He is within the normal range, like I said, 32 to 44 beats per minute. So that is an indication that he may not be in any pain. Digital pulse. So you're going to run your hand down their leg, let them know you're here, not surprise them, and you take it right on the inside of their bedlock. I'm going to see if I can feel it. There is, in some horses you can feel it, and in some you can't. It all depends on just the horse, but usually if you can feel the digital pulse very strong, that is an indication that there's a problem in the foot. Laminitis usually has we call a bounding digital pulse. So if it is a very strong digital pulse, there could be a problem, especially accompanied by heat. So if you feel it, that's not always a problem, but if it is very strong or you don't normally feel it, then that's a problem. The next vital sign I'm going to demonstrate is a skin pinch. This can check for dehydration. So you're basically pinching the skin on the horse's neck and watching to see how long it takes the skin to return to its normal form. If it takes longer than 2 seconds, then that could indicate the horse is dehydrated, or if the skin tense especially. But the thing is, in older horses, the skin can also tend or take a little longer to go back down. Reno is a little bit older, so his might not go back right away, but if they are a very young, healthy horse, sometimes ponies take longer too, but that could mean they're dehydrated. So basically pet them, let them know you're there, and then you want to be gentle when you do it. You're just very gently going to pinch the skin and let it go. And it was a little bit slow. It took about 2 seconds, but it's still going back to its normal form. And again, he is a little bit older, so that indicates he is healthy. So the next thing I'm going to demonstrate is heart rate. Again, it's 32 to 44 beats per minute, but it is different than taking the pulse because you can actually hear the blood going in and out of the heart. You hear the lub-dub instead of just one beat. So you want to make sure you can hear it, and you can tap on it to make sure they can actually hear the noise, and you're going to hear and very gently press it against them right at their heart girth. And you want to press firmly, because if it moves around, you'll just hear rustling. And then I'm going to wait and listen, and my handler Megan is going to time for 15 seconds. And I will tell her when to start. Start. Okay. So I got 9 beats, so times 4, that is 36 beats per minute. That is within the normal range. That was the same as his pulse, and so that shows he's healthy. He may not be in any pain, and he's nice and relaxed. So the next thing I'm going to do is take Reno's respiration rate. Normally it's 8 to 16 breaths per minute. You want to look at the horse's flank to take this, because you can see their sides moving in and out from them breathing. You don't want to look at their nostrils, because even though you may be able to see them breathing, they could be flaring their nostrils, sniffing something. So basically their flank is the best place to take that, and you want to count only when they inhale or exhale. You don't want to count both, because then you'd be doubling it. So again, I'm going to count for 15 seconds and multiply that by 4. So I will let my handler Megan know when to start. So now I'm going to take Reno's respiration rate, and I'm going to count while Megan times for 15 seconds. So I will let her know when to start. Start. Counted 3, and times 4, that is 12, so that's within the normal range. Again, it's 8 to 16 breaths per minute, and 12 is right in the middle, so he is nice and relaxed. He's not scared or anything, and heavy breathing can also indicate some problems. They could be exhausted or scared or in pain, so that is a good sign. So the next vital sign I'm going to demonstrate are gut sounds. Gut sounds are very important to know how to take, because horses can colic. Basically, this is any sort of intestinal distress. It could be something as simple as they're a little stressed out, their gut sounds are a little hypermodal, which means basically everything is moving too quickly and they're probably going to get diarrhea, to a lipoma, which is a ball of fatty tissue with a stem that loops around something internally, or it could even be a twisted intestine or something. So there are 4 quadrants. There is 1 quadrant, or 2 quadrants on each side. There's one here, and one here, and the same on the other side. And the videographer is going to follow me around and going to take his gut sounds. You want to put your hand over the horse so you can feel them if they're doing anything, and it's good that I have a hand there so she can warn me if she sees anything going on. So I'm just very gently going to place my ear on him and listen. Now I'm going to go listen on the other side. So Reno's gut sounds sound pretty good. You want to hear a nice gurgling sound. You don't want them to be running, hypermodal, or you get some even other weird sounds you can hear. You can hear a pinging sound, but basically good strong gut sounds are a great thing, as long as they're not hypermodal. If you hear no gut sounds, that is really bad. If there are very few gut sounds, that it can also indicate a problem, so that can indicate colic. So the last vital sign I'm going to demonstrate is temperature. Of course, this can indicate fever. A horse's normal temperature is 99 to 100 degrees Fahrenheit. So I'm going to do it with a digital thermometer. You can also use a mercury thermometer. With your mercury thermometer, you have to be very careful because they're made of glass, and if they break, they can become very dangerous. So when you take a horse's temperature with a mercury thermometer, you want to make sure it has a string on it, and you can clip it on the tail, or just make sure you hold it. And that's with any thermometer, but digital thermometers are quicker, so you usually just hold them. And also with mercury, you're going to wait about 2 minutes, but first you're going to take it and shake it down before taking their temperature, so the mercury will drop below their normal temperature, so you make sure it's accurate. And with any temperature, you want to add Vaseline first. So you never want to dip it straight in because that can contaminate, so I can take a little bit on my finger and put it on the tip of the thermometer. And you always want to clean the thermometer first, and after you do it. And sometimes the vet even wipes the thermometer on their tail afterwards, and that's okay. So have Vaseline on it, and you are going to stand next to the horse. Make sure you're out of kicking range because the horse may not like it, and you're going to lift their tail to the side. You're going to turn it on, wait for it to load, and then you're going to be very gentle and put it in, and you're going to hold it at an angle so it is against the rectum wall. And if you feel any sort of resistance at all, you don't want to go in any further in. So it came out to 99 degrees Fahrenheit exactly. Sometimes digital thermometers even read a little bit lower. So that is a normal temperature for him. Again, it's 99 to 101. So that indicates he does not have a fever. And that is how you take a horse's vital signs. Everything on Reno was totally normal, so that indicates he's a happy, healthy horse. And if you ever have a horse that may seem sick, if they're showing signs of pain, some signs of colic are they could be rolling or pawing or sweating or looking at their side. They could even be lifting their lip for the fawning position. If a horse is demonstrating anything like that, you definitely want to take all their vital signs, and it is very helpful for if the vet comes, because the vet's just going to do that anyway. You just call the vet and say, oh, my horse is sick. They want to know what's going on, so vital signs are a really good thing to know.